In order for us to evaluate the cancer and come up with the best treatment options, we are going to classify that cancer. And we're going to classify that cancer according to what we call risk. And that risk stratification uses all of those things that we've discussed. It looks at the Gleason score. It looks at the staging system. It also looks at potentially any other x-rays that we've done on that. It puts all of these things together and it will classify you. And it will classify you in terms of the risk stratification and the risk that you have that this cancer will not only grow, but potentially come back if we don't treat this. How does that work? We actually use what's called the NCCN Guidelines. It stands for National Comprehensive Cancer Network Guidelines. And those guidelines have been put together by a group of urologists, and they give recommendations in terms of patients with cancer, and more importantly, patients with prostate cancer. Okay, so we're looking at prostate cancer, and we need to know what is your risk of having this cancer not only just grow, but also potentially coming back. We start with very low risk, we go to low risk, intermediate, and high risk. Again, we're going to think about all of those things that put as part of this puzzle. Grade, stage, any other abnormalities that we may or may not have seen actually on the imaging studies. Let's start with very low risk. Very low risk means that those patients with very low risk have low Gleason grade, okay? Gleason 6, okay, with a low volume of disease. So if you are a patient with low grade disease and a low PSA below 10 and potentially what we call a small or a low PSA density, which means that your PSA is appropriate for the size of your prostate, there is a reasonable chance that you would potentially be in the very low risk category. The good news about that is that you've got all the options in the world, and one of those is potentially active surveillance. We're going to talk about active surveillance in another video, but that means that this cancer can be slow growing, and so slow growing that we don't necessarily have to treat this right off the bat. Low grade and low risk actually means, again, low risk is where it's not a very low risk, but it means that you have a Gleason 6 prostate cancer, there's potentially more of that cancer, or that PSA is a little bit higher than what we would expect for the size of your prostate. So when we look at that, we want to make sure that you fit into that category. So if you fit into the low risk category, you very well might be a candidate for active surveillance. But again, we have to look at that in the entire confines of the Gleason grade and as well as the Gleason score. Okay. Finally, there's the intermediate and the high grades. This is where it becomes important, because if we start seeing a patient with either a intermediate grade of the disease, okay, meaning that they've got a Gleason 7, those patients we tend to recommend, as a matter of fact, we almost always recommend a more aggressive treatment for those patients. We don't want to risk the fact that when you come in with prostate cancer, if that cancer is still contained within the prostate, if we wait too long and that cancer gets outside of the prostate, we can't cure you of that disease. We can keep you around for a long time, but we can't cure you. So we don't want to take that risk if you are at a high intermediate or a high risk of disease. And then we have the final one, which is the high risk. And the high risk of the patients with a high grade disease, or the PSA is that higher, or we're seeing other questionable areas actually on the imaging studies. And for those patients, we almost invariably require a very aggressive treatment. So we look at those pathways, and those pathways let us know what we are going to recommend to you and what NCCN and this group of physicians have recommended using all of the available data, and what are your options and what are the potential best options for your potential risk factor for your particular disease.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.